Good evening, everyone. I'm Shivram Birajdar. Today, I will present my project titled Biostatistical Assessment of Treatment Effect on Hypertension. Hypertension, also known as the high blood pressure, it is a major global health issue and the leading causes of cardiovascular diseases. It is often called as silent killer to severe complication like stroke, heart disease, and kidney failure. The motivation behind this study is to use a statistical method to evaluate how the effective treatment, different treatment, and are to understand the factor that influences the patient outcomes. The data and the variables. We use the dataset from Kaggle with 940 patients, and there is 19 variables. So there is no significant, there is no missing values. The dataset included as the demographic variable age, like age, gender, lifestyle variables, smoking, and the alcohol status. Clinical variables such as BMI, cholesterol, diabetes, blood pressure, and the outcome variables are response and the time to event. The main objective of our study were to evaluate the effect of treatment on systolic blood pressure over time, to compare the blood pressure reduction across treatment group and gender, to analyze change over time using repeated measure ANOVA, to study the survival outcomes using the KPI analysis, to identify risk factor using a Cox proportional hazard model. From the visualization, we use the dataset from the visualization. Um, we can see from the histogram, the most patients are below 30 to 60 years and showing near normal distribution. Overweight is the most common BMI category, and the treatment groups are evenly distributed. Smoking and alcohol patterns are similar across the gender. From the hypothesis testing result, no significant association between treatment group and the response. No significant association between gender and the response. However, the PRT test shows that a significant reduction in BP from baseline to week 4 to week 12. This means that treatment is effective overall, and even if the don't differ much. From the ANOVA result, no significant difference in BP reduction across treatment group or gender, but the BMI significantly affect the baseline BP. Here we see the BMI significantly affect the BP, but which category differs significantly? For that, we use the post-hoc Taki test in under which underweight patient have lower BP than overweight and obesity individual. So means BMI plays an important role in the hypertension. From the repeated measure ANOVA, significant time effects and BP decreases over time, and the significant treatment effects. No significant interaction between treatment and time. This means the BP improves over time, but treatment patterns are broadly similar. From the survival analysis, from a Kaplan-Meier curve, we conclude that there is drug A has a significant higher survival probability, followed by drug B and placebo. And the treatment works better in non-diabetic patient, and the alcohol does not change the treatment effective as much. From the cost proportional hazard model, our key findings are the drug A reduces the 56% risk, and drug B reduces the 35% risk. Alcohol increases the risk by more than 2 times, and the diabetes increases the risk by 66%. That means though lifestyle and the clinical factor strongly influences the outcomes. From the conclusion, we conclude the blood pressure significantly decreases over time, and the treatment is effective. So no major difference between treatment group in BP reduction. Drug E performed based in survival analysis, and the BMI, alcohol, and diabetes significantly affect the outcomes. Here are some recommendations. The drug is the most effective treatment, and the regular BP monitoring is important. Reduction of alcohol, reduce the alcohol consumption, that is very important, and manage the diabetes carefully. Encourage healthy lifestyle and weight control. Use the professional treatment plans. Here, while treatment improves hypertension overall, the patient-specific factor like diabetes, BMI, and alcohol use the play and crucial role in determining the outcomes. Thank you.